Relative hypovolemia. Case presentation. Patient information. Name, Emily. Age, 9 years. Medical history, no known allergies or previous anaphylactic reactions. Emily, a 9-year-old girl, was attending a friend's birthday party where various foods were being served. She had developed a severe allergy to peanuts, which had never been diagnosed before. During the party, Emily consumed a peanut butter cookie, triggering a severe anaphylactic reaction. Presentation. Shortly after consuming the cookie, Emily began experiencing symptoms of anaphylaxis. She developed hives on her skin, experienced difficulty breathing, and complained of throat tightness and itching. Recognizing the severity of her symptoms, the parents immediately called emergency services. Emergency response. Paramedics arrived promptly and assessed Emily's condition. They noted her rapid breathing, increased heart rate, and low blood pressure. The paramedics administered an epinephrine autoinjector to Emily's thigh to counteract the allergic reaction and mitigate the anaphylactic shock. Epinephrine acts as a vasoconstrictor, helping to restore blood pressure and reduce blood vessel permeability. Emily received intravenous fluids containing saline to replenish her fluid volume and increase blood pressure. Over time, her symptoms began to improve, and her blood pressure gradually returned to normal. This case illustrates how an anaphylactic reaction in a child can lead to relative hypovolemia due to the vasodilation and increased vascular permeability associated with anaphylactic shock. What is the basic definition of shock? Shock is an acute, complex state of circulatory or metabolic dysfunction that results in failure to deliver or use sufficient amounts of oxygen and other nutrients to meet tissue metabolic demands. What is the name of the shock with relative hypovolemia? Distributive shock is a state of relative hypovolemia resulting from pathological redistribution of the absolute intravascular volume. Absolute hypovolemia is either uncontrolled, volume loss continues, or controlled, volume loss has been stopped. Relative hypovolemia, blood volume is normal, increased, or decreased, but vascular capacity is increased. What are the 4 types of distributive shock? Sepsis, dysregulated host reaction to infection. Anaphylactic, severe IgA-mediated reaction. Neurogenic, severe traumatic brain or spinal cord. Endocrine/metabolic Addison crisis, beriberi.